So this year I'm teaching epidemiology, so looking at infectious diseases and public health. It's kind of never been more timely. I also teach our senior seminar in health policy and management. And in the spring, I'll be teaching a research seminar where I will actually be in Puerto Rico and working with students here in Providence who will then, at the end of the semester, come down and spend some time doing some research with me on this project. Yeah, so my PhD is in anthropology with a specialization in medical anthropology. So that can mean a few different things, but for me, what I'm really interested in is the study of health and illness from an anthropological perspective. I've looked at how health systems are organized and how they allocate care to different populations differentially. I'm also interested in how money plays into the picture and financial logics come to shape our healthcare system. And finally, I look a lot at how everyday people try to access care and trying to care for themselves and their families as they try and maneuver through and navigate and make sense of healthcare systems. We were lucky enough to be awarded in March of 2021 a grant through the National Science Foundation for a collaborative research project at predominantly undergraduate institutions, which means that we are incorporating undergraduates into the research that we're going to be conducting in Puerto Rico. So the project title is Ethics of Care and Compounded Disaster, Transformation in Puerto Rico After Maria. I'm collaborating, I keep saying we because I'm collaborating with a fantastic colleague and friend who's an anthropologist, an artist, and poet, Adriana Garriga Lopez, who's a professor at Kalamazoo College. And we've been working together as a team to design and implement this project and incorporate students both from Providence College and from Kalamazoo College into our research. Yeah, I mean, I was really thrilled to get the news in March that we received the award. It's my first federal grant as a researcher. It's also the first award that has of this magnitude that has occurred in the School of Professional Studies, and the first federal grant in my department, Health Policy and Management, as well. So we're really excited to be kind of breaking this new ground, and has really allowed me to scale up a project for which I've received a lot of seed funding and support from within Providence College. So benefited from CAFR grants, from School of Professional Studies grants from the Provost's office. There's been a lot of seed money and support for this kind of research and for incorporating undergraduates into research with faculty. And that has really kind of yielded this benefit of expanded federal funding. So I'm really excited to see what comes next. So we found a much more kind of proactive and pro-social response, I think, to COVID when we traveled to Puerto Rico. Although when we got there, certainly Delta was taking off, and so, you know, even despite this environment where people were taking it more seriously, it didn't create complete immunity to Delta, right? It was still spreading. There's still a lot of very active tourism sector on the island, particularly when there's travel restrictions for US residents to go to so many other places, but they can continue to travel to Puerto Rico, and they were certainly doing that over the summer. And so we saw, you know, the numbers were increasing as we were there. And so we had this really interesting experience of, you know, thinking we were going to be able to do a lot of in-person field work because we had all been vaccinated and we were feeling really confident about the efficacy of that vaccination. But as Delta started spreading and there was more and more data about breakthrough infections, by the end of our research trip, we were doing a sizable amount of our interviews on Zoom in combination with in-person stuff, even though we were, you know, actually in location doing field work.